Our next speaker is Christian Dahmen from University of Oldenburg in Germany. Christian is head of the Vision Feedback Project Group, Project Group for Vision Feedback for Nano Handling. And he is personally working on and going to report on his work on vision processing algorithms that can help to automate nano handling tasks. Christian, welcome.
Thank you. Okay, first of all, thank you very much for giving me the opportunity to be here a second time after last year, the presentation. And yes, I want to present the current state of a European project which is called NanoMA, and it is dealing with the MRI-based navigation and control of micro and nanobots to achieve targeted drug delivery in contrast to conventional approaches. This? Oh. Okay, so first some things about the topics what I'm going to talk about. First of all, I will present the concept of the MRI-controlled targeted drug delivery. I will say something to the multidisciplinarity of this approach because it involves much input from many different disciplines. I will talk about the MRI-based tracking and propulsion of the capsules. Then one core topic is the analysis of the MRI artifacts which are produced due to the imaging of these small ferromagnetic particles. Then I will say something to the design of these capsules and nanoparticles and give a short report on ongoing developments and the achievements what we did and the demonstration scenarios which we are going to test it in. So first of all, targeted local drug delivery means we have a tumor here and we diagnose it, and then we just inject some functionalized particles, functionalized nanobots or microbots into the cardiovascular system, and then we make them gather around the tumor and directly target the tumor. So that is how it's done already in some cases. But in our case, we want to inject them and stay together like a group. And then we control them in a very deterministic way to move them to the place where they should work. So there are a few challenges concerning this work. First of all, we have to improve our imaging to be able to image to diagnose the cancer tumor and to image the particles to be able to control them. Then we have to somehow make them go to the right place so that they can work. And then, of course, these particles have to kill the cancer cells in some way. So, and the project NanoMA aims at developing a system to do drug delivery near the tumor. That means we use the MRI as not only as an imaging system, but also as a propulsion means. So we use the magnetic gradients produced by the imaging coils to push the particles in the direction where we want it to be. So we use enhanced diagnostics using the MRI. We're working on that. We use the in vivo propulsion and navigation of the particles, and we use nanobots to target the tumor with drugs. So there are quite some different disciplines involved in this. First of all, of course, we have the system and the hardware. So we have modifications to the MRI system, which should be constrained to software, not too much hardware changes due to regulation problems then. Then we have the nanocapsule fabrication. We have to produce them. We have to make them work in the way like we want them to. And we have to either develop or take drugs and functionalize these nanocapsules with the drugs. Then we have to use simulation, first of all, for the nanocapsule fabrication to make sure that the fabrication works. And of course, also to validate that our approach of propulsion and imaging is valid. And then, of course, the biological side. So materials, what we have to use, the biological effects, what we are going to exploit using the nanoparticles. So how we are going to do that, we have to implement 3 essential components which we need for the navigation of these untethered nanobots in the human body. First of all, we need propulsion. So we use the 3 imaging coils of the MRI system to push the particles. And that means we have to control the MRI in that way that the gradients are switched in that way so that we move it. Then we have to track and locate the particles using the standard hardware of the MRI and additional software. And we have to control it. So that means combine the information what we got from the tracking and the possibilities what we have about propulsion to control it in the way that we want it to move. So in this, on the right, there is the system approach what we have. So we have the MRI system with the nanocapsules somewhere in the body. Then we do image generation. So we extract images of the area surrounding the particles. We do image processing and extract the position of the particles, of the nanobots or microbots. And then this gets transferred to a controller which will decide where the nanobots should go according to pre-existing data on the cardiovascular system and the path what we have to take. And then this controller decides directions and paths and programs a low-level controller which will switch and decide and design the gradients to do that. And of course a user interface so that everything can be controlled by a doctor. So in order to see where the nanobots are, we have to image them due to the fact that these nanobots are ferromagnetic material, so that we can push them using the gradient coils. We are getting very strong artifacts and very big artifacts in the images, scaling much greater than the size of the particle itself. So we simulated these artifacts for certain small particles, and we validated that in experiments. The goal is we want to quantify how big the artifacts are, to understand the process of artifact formation, and then to conclude back to where the artifact is, where the particle is when we have a certain artifact in a certain way. So the most important effects in these artifacts are spatial misregistration of the MRI and intravoxel dephasing, so that means loss of signal. And the most important parameters, considering the sequences of the MRI, echo type, echo time, receiver bandwidth, field strength. There are a load of other parameters, but these are the most important for this. So we simulate it using, we solve the Bloch equations in a voxel grid. That means the relaxation of the spins. And we use as input, of course, geometry, resolution of the grid, then a relaxation time matrix, material depending, the magnetic field around the object, then sequence parameters like echo time, repetition time, and so on, receiver bandwidth, then the strength and orientation of the external magnetic field, flip angle, and the number of subvoxels for dephasing simulation. So one thing what we first simulated was the magnetic field around these nanobots. So here we have one small ferromagnetic particle, and we simulate in different orientations the magnetic field around it, and we use that as input for the image generation simulation. And in order to verify it, we did experiments on magnetic particles embedded in agar in PE bottles. So here we see the MRI imaging artifact of a 2 millimeter steel sphere in a big agar block. And as you can see, the artifact spans much further than the size of the particle would like be. So that means we have really wide spanning artifact, almost spanning the whole bottle here. So this is done using gradient echo scans, some parameters. It's not so important to go through this. So, and to compare the imaging and the simulation, we did similar parameters and similar objects. So here we have a gradient echo scan of a 3 millimeter steel sphere, and we have here the simulation of the same object in the same setting. So as we can see, there are still some differences, of course, but in general, it matches quite okay. We are not yet finished with this simulation. There are certain parameters which we didn't simulate yet, but we are on the way. And this is a spin echo sequence, the same particle. So we see the artifact is looking quite different, but the simulation, well, not perfect, but it is in the right direction. The problem is that the simulation of MRI image formation is quite time-consuming and quite some effort. So what we are doing more, we are trying to segment the artifacts so that we can extract geometrical features, so that we can later find them in images, even if we don't know a priori where they are, the particles. So this is a segmentation of gradient echo artifact of a 2 millimeter steel ball. And as we can see, it has a certain characteristic shape. And this is very, very important if we want to find it later in the images. And another thing, what we are working on, the problem what we have is that all these experiments, what we did up to now, are of big particles, millimeter size. So we cannot steer them through the cardiovascular system, of course. So the idea is to agglomerate small nanoparticles. And the question was, do they behave for the imaging in the same way like the solid particles? Because if we have few 10 or 100 nanometer size particles somewhere, we cannot see them with the MRI, except for, contrast agents are nanoparticles. So if we put it, we get a signal loss, but we don't know exactly where is the single particle or where is like this. So the idea was to use them to agglomerate and to stick together. And in this case, this is a segmentation of an artifact of an agglomerate. So we took a ferrofluid with 10 nanometer size particles and put it inside. It's constrained to a very small space. And we found out that at least under certain circumstances, this group of nanoparticles, very many nanoparticles, is behaving in the same way like a solid particle. As we can see here, we have still the artifact, we have a characteristic shape, and the size, of course, is smaller than a solid particle, but it's still big. So we can still find it in the images, which is very important if we want to control a group of nanoparticles, of course. So what is going on else? Apart from the imaging, partners in Europe have developed simulation system to simulate the functionalization and fabrication of nanoparticles. So we are working on different kind of nanoparticles. We have here, for example, a spherical nanoparticle functionalized with some biomolecules. We have here a carbon nanotube, which is filled with ferromagnetic material and is functionalized with some molecules. And we have here, again, a carbon nanotube, which is filled then with a chemotherapeutic agent, for example. So the goal is with this simulation to find out what is a feasible way of first producing it, and which will allow us at the same time later to control it in some way in the MRI. So, and for that there have been quite some simulations going on. For example, here the carbon nanotube, single-walled carbon nanotube, which is functionalized with peptides, and then the interaction of the carbon nanotube with biological tissue, for example. And the results have been quite promising, but we are still quite far. We have to go still. And at the same time, what has been simulated is the encapsulation of chemotherapeutics or drugs inside these carbon nanotubes, how to do it if they would fit inside, and how much effort it has to be to produce them. But still, it's possible, and well, we are on the way of doing that. So, and what is going on further? Of course, we are also trying to produce them, not only simulate them. We simulated them in the consortium, but there are also approaches to produce exemplary nanoparticles with different functions, of course, like some functionalization to target the cancer cells, some ferromagnetic material, some drug inside, and so on. And what we're doing more is we're working on diagnostics, MRI-based diagnostics, to improve the use of this MRI as one system, not only for diagnosis, but like for the whole cycle of diagnostics and therapy. Then, of course, we're working on the magnetic steering of the particles, where there is one problem: we cannot steer really small nanoparticles if they are alone, because just there is some scaling effects in the forces. So we have to agglomerate them to behave like one big particles. But we're working on that. And we're working on path planning. So we extract the cardiovascular system from MRI images and try to determine the best possible path for a particle to go to a desired goal, like a tumor. Yeah, and something to the demonstration scenarios which we're going to work on. First of all, we want to try it in phantoms, human-sized phantoms, to recognize and track the objects, the ferromagnetic particles, then propulsion along a pre-planned path. And in a second phase, we want to do that in an animal to just verify that it's possible and doable. And in a phase 3, we will first evaluate the toxicity in cell cultures, not in animals, not in any living being, but so that we can be sure that it works in the way that we want it to be. So just some short words about the consortium in this project. So we are 8 partners who are working on that in Europe. University of Orléans is the coordinator. Then we have Xenon, which is a company from Greece, ETH Zurich, University of Oldenburg, where I'm from, the Biomedical Research Foundation from Greece, University of Cyprus, Femtotools, which is a small company in Zurich also, and the Pius Hospital Oldenburg as a medical partner. Okay, and that's, thank you for your attention, and I'm open for questions.
Please come up to the microphone and announce your name. Again, even if you announced it before, some people on the video site, all of the presentations are broken up by each topic. So somebody might see one topic and not the other, and hence the need to repeat your affiliation.
Bob Borges, University of Alabama, Birmingham.
Yeah.
Others have used directed ferrous impregnated catheters and other devices by utilizing MRI for the direction and the propulsion and other imaging methods for the imaging to avoid the problems with with artifact.
Yeah.
It's amazing what you've done, removing the artifact. But have you thought of, and I'm sure you have, has anybody done work on using another imaging modality for the imaging and then the MRI for the propulsion? For example, if you can direct your nanobots to the tumor using fluoroscopy or CT, but use the MRI, because there are combined systems now, to propel the...
Well, I mean, of course, we thought about that. The thing is, I think they didn't use the MRI itself for propulsion. I think if you use, for example, I think there are systems like X-ray or something, and you can use additional coils. It's not real in MRI. And the thing is, our goal or our idea was an MRI, as it is in many hospitals around the world. So if we can somehow make this MRI, as it is, to work in this way, it's like a cost advantage.
Oh, I
so
agree.
we don't have the need to take another system like a navigation system, propulsion system additionally, which will cost probably really load of money and will perhaps only be used in certain cases. So that's the reason why we try to do it on the MRI as it is, and also not to modify the MRI in any hardware way, so that a standard MRI can be used, which is available.
With just a software upgrade?
Yeah.
Great.
Should be. I mean,
Thank you.
We hope.
I think we should take advantage on diseases. You know, what I said is strange. But many diseases have some things typical to them that if you make use of it, you can benefit a lot. And cancer is one of these excellent example. And cancer has what we call the EPR effect, enhanced permeability and retention, in which the vascular to the blood vessels in the tumor are porous and small particles can leak to the tissue specifically, and while you don't get them in normal tissue. And we demonstrated long ago, and I'll discuss it in my talk. But I think what I want to say, that actually you don't need to propel your particle to the tumor. They find their way because of the EPR effect. And I'd show a very nice concentration of particles in tumors and also in inflammation site. These are two major syndrome of diseases, whatever, that you can take advantage on this. And then what you have left over is to do other things you want to do, the release and get the control release and having a way to follow it. The other problem that I find with MRI is that the resolution that you have now, when you see a tumor, it's much too late. I think you have really a major problem. We look, but the EPR effect starts much earlier, when you have still a nanoscopic damage in the tissue. When the tumor just started, you can see the blood vessels form. They're one of the first things that happen, and they are porous, and the particle will leak out. So you can take advantage of it. Now, a lot of work was done with MRI and liposomes, and they can be followed wonderful if you add the right probe to follow it. And you can do a very nice imaging with it. So you can enhance your imaging, but I think what you have to go is backward, really, and try to improve the resolution to the level that you have less than 1 millimeter tumor that you can see. And then you start talking something serious, I think.
Okay, but the thing is that the goal is not to direct these particles until the tumor, but into the feeding vessel. So that means we try to target it more than conventional, for example, chemotherapy. So we don't flood the whole body using some chemicals or some drugs, but we try to at least bring it in the near the tumor, so that, of course, in that area we still have side effects, collateral damage, and so on. But we have like a more targeted approach. So that is the idea behind it. So
we bring it to the EPR, not we. That's a disease made. Bring it to the tumor, to the tumor tissue itself, already extravasate, inside the tissue itself. Then you can do whatever you can do. That depends on your imagination, on your technology, or many other things. But that's another aspect. But bringing it to a tumor today, for people in our field, is not a big deal anymore.
Okay. I'm looking forward to your presentation.
Next question in the, on the back right side of the room. Yes, please. From Ohio State.
Yes, indeed. Stephen Lee, Ohio State University. So I agree that EPR effect is potentially extremely powerful. However, tumors are not homogeneous spaces. In fact, there are necrotic domains, there are domains with greater or lesser degrees of perfusion. So once it arrives at the tumor, and in fact, once it extravasates, there still is a barrier that needs to be crossed by the therapeutic.
Yep.
And so I wonder if you could comment, are there any provisions in your design for subtumor navigation or directing of materials once they have reached the tumoral site?
Well, at least not from the propulsion side. I mean, we cannot. There's the problem that we cannot image so small structures. I mean, if we like tumors are chaotic, tumors may have certain areas which are small, but still. We would be, like to target them also. But the thing is that we cannot only control these particles on a bigger scale, at least in the MRI. If we use different imaging modalities, maybe. But using this, I think there is a certain limit on how small we can go.
Thank you.
Dr. Blumberg, you have a question?
Thank you. Dr. Brooke Blumberg, Philadelphia, Fox Chase Cancer Center. Just a general medical or comment, and that is there's concern that therapies that are directed towards killing cancer cells and not killing normal cells have to some extent been disappointing. And a good deal of the current reevaluation in the treatment of cancer and prevention of it is based exactly on that. That is, even though you can direct the medication to the tumor, there still is a great deal of killing of the normal cells because the differences between tumor cells. Now, that's been a problem ever since cancer chemotherapy has started. And I think this is a caution, we need to observe. If I understood correctly, this doesn't deal with metastases unless they're very large. Is that?
Yeah, I mean, if we want to control the particles to a tumor, it has to have a certain size, else we cannot do it. At least not with the MRI. Then we would have to use different modalities.
I see. Thank you.
Okay, well, Christian, thank you very much.
Thank you.
Christian, we really respect that presentation, and you give us all, I think, a lot of hope that we have some means of positive control for the millions of nanobots that we ultimately expect will be circulating in our body and for achieving therapeutic functions.